Imagine this for a moment. You're going about your normal day. You cook breakfast, take your medicine, maybe watch your favorite TV show, and everything seems fine. But quietly inside your body, something is changing. And here's the part most people never hear. Sometimes the earliest signs of pancreatic cancer are so small, so easy to explain away, that people simply ignore them. Not because they don't care, but because they truly don't realize what their body is trying to say. For millions of people, this quiet delay is the difference between catching a problem early and finding it when it's already too late. That's why this video matters, especially if you're over 50, caring for yourself, your spouse, or your parents. Because by learning just a few important symptoms, you may help someone you love catch this hidden disease earlier than they ever would have. And that knowledge could actually save a life. Let's begin. Pancreatic cancer is often called the silent killer. Not to scare you, but to remind us why awareness is so important. The pancreas is a small organ that sits deep inside your abdomen. It makes enzymes that help digest food and hormones that control blood sugar. It's quiet. It does its work behind the scenes. Because it is tucked away, tumors can grow without being noticed for months. That's one reason survival rates are low. Only about 12% of people live 5 years after diagnosis. Not because they don't fight, but because the cancer is usually discovered late. Here's the hopeful part. Researchers now know that many symptoms actually show up 3 to 6 months before diagnosis, but people dismiss them. Today, we're going to look closely at the 8 most surprising signs. Some may feel common, some may seem unrelated, but together they create a pattern doctors really pay attention to. And there's something else powerful. Studies show that recognizing at least 3 of these symptoms together may improve early detection by up to 70%. So let's move gently through each one with care, clarity, and guidance you can actually use. And remember, don't panic. These symptoms can also come from many harmless conditions, but being aware can help you take the next step sooner. Let's start. Here's the first sign, and it often appears quietly. Digestive problems. Let me tell you a small story. Mr. David, age 67, enjoyed simple meals, rice, vegetables, and sometimes tea. But over time, he noticed something strange. After eating, he felt full quickly. Food seemed to sit in his stomach like a heavy brick. He lost interest in meals. He began skipping dinner because it made him uncomfortable. He thought it was just aging. But what he didn't realize was that his pancreas wasn't making enough enzymes to digest food properly. When pancreatic tumors block the ducts, the digestive process slows down. Food doesn't break apart the way it should. This leads to nausea, vomiting, bloating, and loss of appetite. Over time, weight drops, and not in a healthy way. Muscles weaken. The body becomes tired because it isn't absorbing nutrients. One special clue many people overlook is stool changes. Because fats are not broken down, the stool can become pale, greasy, and floaty, sometimes with a strong, unusual smell. This isn't just embarrassing. It is the body waving a flag saying, something is wrong with digestion. Most people blame fatty foods or stomach upset, but when it happens often, especially along with weight loss, it deserves attention. Here's the important takeaway. Digestion changes that keep repeating, not just once, need to be discussed with your doctor. Tests are simple, and sometimes pancreatic enzyme supplements can even help. Now, let's move gently to the second sign. Fatigue, the deep kind. We have all felt tired, but cancer fatigue feels different. It's not, I stayed up late, tired. It is exhaustion that stays even after resting. People describe waking up tired, walking across the room and needing to sit down, or losing interest in activities they once loved. Inside the body, cancer cells consume nutrients, stealing energy from healthy tissues. The body becomes weak. Even simple tasks, bathing, cooking, walking, start to feel heavy. Emotionally, this can bring sadness, worry, and frustration. Many seniors assume it is just age or stress. But here's a gentle reminder. If fatigue keeps getting worse, does not improve, and comes with weight loss, digestive changes, or other unusual symptoms, that's worth checking. Because sometimes this early tiredness is the second piece of the puzzle. Now, let's look at the third sign, something people almost never connect to pancreatic cancer. Fever and shivering. When the pancreas becomes inflamed or bile ducts are blocked, the immune system reacts. This may cause off and on fevers, sometimes high, sometimes mild, often with chills. Unlike regular infection fevers that clear in a few days, these can come and go and return again. Some people sweat at night. Others feel hot one moment, freezing the next. The body is fighting inflammation and stress inside. If fever continues or keeps returning, especially with jaundice, yellow skin, or eyes, it needs quick attention. Now, let's talk about something truly unexpected. Blood clots. Most people think cancer causes pain or weight loss, but not clots. However, pancreatic tumors often release chemicals that make blood thicker and more likely to clot, a condition doctors call hypercoagulability. Don't worry about the word. It simply means blood clots easily. These clots often form in the legs, called DVT, deep vein thrombosis. The leg may swell. It may feel warm or tender. The skin may look reddish or blue. The real danger happens when a piece breaks loose and travels to the lungs, causing sudden chest pain, trouble breathing, or fast heartbeat. That is a medical emergency. So if unexplained leg swelling appears, especially without injury, never ignore it. It is better to get it checked early than risk complications. Next, let's talk about the fifth sign, changes in the gallbladder and liver. When the bile duct is blocked, bile cannot flow properly. The gallbladder fills up and becomes enlarged. Sometimes doctors can even feel it during physical exams, like a firm mass under the right ribs. Imaging scans, ultrasound or CT, reveal swelling. The liver may also enlarge due to trapped bile. It's like a traffic jam inside your body. One blocked area affects everything around it. Doctors often pay close attention to these findings because they can strongly suggest pancreatic trouble. Now, moving to another symptom many people brush aside, gas and bloating. We all experience gas sometimes, but in pancreatic cancer, it can feel different, ongoing, persistent, and unrelated to heavy meals. Because digestion slows, gas builds. The stomach feels tight and stretched. Even a few bites can make someone feel full. People often take antacids, change diets, or just assume age has slowed their stomach. But when bloating is constant, uncomfortable, and doesn't improve, doctors want to know why. And now we approach one of the most recognizable signs, pain in the tummy or back. Imagine a dull, deep ache starting near the top of your stomach, then spreading toward your back. Sometimes it feels like pressure, sometimes burning. It often becomes worse after eating or when lying flat, and improves slightly when leaning forward. This pain may start occasionally, then slowly become more frequent. When tumors press on nearby nerves, pain signals travel through the abdomen and spine. Not every stomach ache means cancer, but persistent, unexplained upper abdominal pain that spreads to the back is a red flag worth understanding. Finally, let's talk about a sign many people actually notice first, but misunderstand. dark yellow, or brown urine. When bile cannot move into the intestine, a substance called bilirubin builds up in the blood. Instead of being passed through stool, where it normally gives stool its brown color, it exits through urine. The urine becomes dark, like strong tea or cola. Even if you drink a lot of water, the color stays dark. Soon afterward, skin and eyes may turn yellow. This is called jaundice. But here's the important part. The urine often changes color before the skin turns yellow. So noticing this early, especially if it lasts more than a few days, gives a valuable head start. Doctors can run liver and pancreas tests quickly and safely. Now let's pause. I want to say something especially for seniors watching. These symptoms can be scary to hear, but fear is not the goal here. Awareness is, because the problem with pancreatic cancer is not weakness, bad luck, or poor choices. The real problem is silence, symptoms that disguise themselves as harmless everyday issues. Heartburn, fatigue, back pain, bloating, dark urine, all common things, right? And that's exactly why people ignore them. They wait. They assume it will pass. They don't want to bother the doctor. But here is a powerful truth. When pancreatic cancer is found earlier, treatment options improve. Quality of life improves. And the chance of living longer goes up. Doctors now recommend seeking help when digestive problems don't go away, fatigue keeps getting worse, urine stays dark, unexplained weight loss appears, pain keeps spreading to the back, blood sugar suddenly changes. Especially in older adults, here's something interesting. And many people ask this question, can new diabetes be an early sign? Yes, in some seniors, new onset diabetes can be linked to tumors affecting insulin production. Not always, but it's another piece of the puzzle doctors look at carefully. So what can you do? First, listen to your body with kindness, not fear. Second, write symptoms down. A simple notebook can help your doctor see patterns. Third, do not diagnose yourself. Instead, use this awareness to start conversations. Early testing can include simple blood tests, imaging scans, and supportive treatments. And always remember, many people with these symptoms do not have cancer. They may have gallstones, liver issues, pancreatitis, or simple digestive troubles. But ignoring symptoms is never the best answer. Before we close, let's loop back gently the way good health education should. Digestive trouble that keeps returning, persistent fatigue, fevers, and chills that come and go, blood clots or swollen legs, enlarged gallbladder or liver on scans, persistent gas and bloating, tummy or back pain that deepens, dark yellow or brown urine if 3 or more appear together. Especially over weeks, that's your cue to act sooner rather than later. Because time is powerful, early action leads to options, and options lead to hope. And hope, my friend, is something no disease can ever truly erase. Let me end by saying this. You deserve to feel safe. You deserve answers. And you deserve doctors who listen carefully and treat you with respect. Your awareness today could become someone's second chance tomorrow. So if this message helped you, consider sharing it with someone you care about. A brother, a neighbor, a spouse, a parent. Information spreads quietly, and sometimes it reaches the right person at the right moment. Stay gentle with yourself. Stay curious about your health. And remember, knowledge isn't scary. Knowledge is protection. Thank you for spending this time with me, and I'll see you in the next video.